Number three, the patient experience excruciating pain, excruciating body pain. Hello, hope I'm being heard. Hello, those listening to me, hope I'm being heard.
Yeah,
good. Thank you. Now, you find the patient experiencing excruciating pain. And the same reason why the same reason we deduce for fatigue is still the same reason that we will still deduce for excruciating body pains on the legs, chest, back, all parts of the body. The bones are not happy at all. Why? Because oxygen is not getting to the cells. So you find the constant excruciating pain. In some other cases, we see swellings in some parts of the body, the hands, the feet, and it is not healthy at all. Why? Because these sickle cells get stuck to blood vessels, and because oxygens are not moving to the hands and feet, they're not getting to the cells there, you now find these sections of the body getting swollen. Another thing we see again with those with sickle cell disease is that there's coloration in their eyes and skin, what we call icterus or jaundice. And it's because the job of the liver, which includes, among other things, filtering of red blood cells, is being hampered. As such, there's more release of bilirubin as a result of this sickled red blood cell presence around the liver. So you now find more release of bilirubin. And once there's a bilirubin buildup, it then tends to lead to icterus or jaundice. So you now have the color of the conjunctiva of the patient looking yellowish. And when you look at the skin of the patient, you find it being yellowish. That's why it's easy to tell when somebody has the SS genotype and sometimes SC. Though with SC, if you do not look closely, you may not be able to identify that the person is a sickler. Why? Because facially, they look a bit healthy compared to those with SS. But it's only when they begin to come down with those predisposing conditions, those symptoms, that once a test is done, we can then identify that the person has the sickle cell disease. Now, let's look at some of the complications of this disease condition. Number one, the patient experience complications like acute chest syndrome, ACS, or vaso-occlusive crisis, VOC. I'll be looking at these two very well later. But before we go to these two, let's kindly cover some other complications that we may not know. But today's class is really going to afford us the opportunity of knowing. Number one, chronic kidney disease. Chronic kidney disease. Those with sickle cell anemia do experience chronic kidney disease with some patients. And that is because there's lack of oxygen to the cells and tissue, leading to tissue damage. Another thing that we have observed with those with some complications with those with sickle cell disease is detached retinas. Detached retinas. And that is because the sickle cells, because they are sticky and stiff, they block blood vessels. They block blood vessels to your retina. So you now find these patients having what medical refer to as detached retinas. There's another condition we see, especially with the males. It's called priapism. Priapism is another term, medical term for painful erections. Painful erections, where you find the male flow, once they have erections, they begin to as if they are crying. Can you imagine? And that is because this same sticky red blood cells caused by sickle cell disease blocks the blood vessels around the penis. And because the blood vessels around the penis are blocked, especially if that male is having the sickle cell disease, you now find the patient experiencing painful erection, prearrhythmia. Then there's another condition they experience again, known as splenic sequestration. Splenic sequestration. And this one has to do with the spleen. Once it is affected, medical personnel do see patients with splenic sequestration. And this can lead to severe or acute anemia with the patient. Then another condition that is equally another complication that is seen with those with sickle cell anemia is there's possibility of stroke. Why? It's very easy. Why? Because the blood vessels are blocked. And once the blood vessels are blocked, the patient stands the risk of having stroke. Even among babies, pediatric stroke have been experienced among babies with sickle cell anemia. Pediatric stroke have been observed. So these are some of the complications. Then let's dive into the other two that I started with, acute chest syndrome as well as vaso-occlusive crisis. What is an acute chest syndrome? Now, an acute chest syndrome is the most common complication of sickle cell disease or anemia. And it happens when sickle cell clumps and clog blood vessels around your lungs. So some of the symptoms this patient experiences sudden chest pain, cough, fever, and difficulty in breathing. So these are some of the signs and symptoms that the patient may present, those with acute chest syndrome. Then the other one is vaso-occlusive crisis. And this is when the blood vessels are deprived of oxygen. Once they are deprived of oxygen, especially around the cardiovascular region, you now find the patient having what the medical personnel refer to as a vaso-occlusive crisis. So in a nutshell, we've been able to do a quick expose of sickle cell anemia. I'm sure all of you listening to me now, you can even lecture this to someone else. I bet I can hit my chest and say, yes, all 24 of you listening to me can lecture on sickle cell anemia. That is now the question is, were we having this disease in the past? Yes. Our forefathers had experienced this disease, though back then, most of them never knew how to go about the test. It is so sad to see that even in our modern era, you find young adults who fall in love, having known their genotype, still taking the risk of getting married. You find a young man who is AS taking the risk to marry a lady for love, because of love. And the lady is so obvious, her genotype is AS. They begin to assume that they may not have the risk of having a sickle child. Such risk is a big gamble. I want to advise those who are listening to me here. If you have a son or a daughter whose genotype is AS, please advise that child, don't gamble it. Please don't gamble it. Once your fiancé has that same genotype, please cut off that relationship. We cannot continue having children with sickle cell anemia or sickle cell disease. Why? Because no matter how strong that love is, once you have children with this disease condition, the love will go away. There will be no more love in the house. Why? Because the child will bring misery one way or the other. Constant hospitalization is not what you need in your marriage. So back then in those days, our forefathers had this issue, but they had their own traditional therapy that they were using. And that is why herbal therapy coming to us through stem cell technology is really going to prove useful in today's class. Just like Farm Chileka will be exposing, as well as our coach, Samson, will be presenting to us, you're going to see reasons why those who have even made the mistake of having sickle cell children, they can still and count on Super Life for help. But let's look at what our forefathers did. For them, they used the pigeon pea that we refer to biologically as Cajanus cajans, the pigeon peas. Then they equally use the soya beans. We are equally aware of soya beans and real honey. So what they were doing back then was to mix 1 dessert spoonful of dry powdered pigeon peas and the same amount of powdered soya beans into half glass of water. Then they add 4 dessert spoons of honey. So you now find parents whose children were having this condition, giving their children half glass twice daily. Now, this was how they were handling it. But today we now know better. Coach Samson will be coming up to give us details on how Superlife have equally advanced on this technology, and today patients with sickle cell disease are now being helped. At this point, I want to appreciate all those that have been listening to me, and I want to call on my able farm Chilaka, to take on the stage right now. Farm, are you there? Hello, Farm. Hello,
I am here, sir.
Yeah, you have the floor.
I am here, sir. Good evening, sir.
Yeah, good evening. You have the floor, Farm.
Okay, sir. Good evening, everybody. Good evening, sir.
Yeah, you are welcome, Farm. Good evening.
Yes.
I want to use, sorry, before you continue, this junction, thank God, Dr. Chus is here, is in the room. I believe by the time from Chinaka is through, Dr. Chus will come in. I believe, thank God for the favorable network weather. Thank you. Oh, yeah, go ahead.
Okay, thank you, sir. So let's run through it. Sickle cell anemia, it is something that we actually need to talk about. I, for one, I believe that I'm of the opinion that churches and religious societies and cultural groups should add the subject of sickle cell anemia on their programs. The reason is to find a way to educate a vast number of individuals, especially the younger generation. Because until you are informed or educated, you may not take the right decisions, especially as it concerns the issue of genotype and sickle cell anemia, right? So quickly, just to add to what Prof had said as regards sickle cell, it's a genetic disorder. In other words, it is not something that is caused by a disease factor, say a microorganism like bacteria or fungi, and all that. No, it is actually a genetic disorder that can be prevented or that is avoidable. And I could see the passion in the tone which Prof was discussing it, where you have young people taking these wrong decisions, wrong steps in the name of being in love very, very seriously. Anemia, just to add to what Prof said, the word sickle, just imagine scissors. That was a sickle. Imagine scissors. There is a particular farming equipment. I remember in my basic agricultural science, we call it sickles, right? It's used when harvesting rice, I think, right? Now, it's just imagine scissors. You know, when you see a scissors, right, there is something in the middle, like a fulcrum, that links up the part of the scissors that you hold with your hands and the other part that has two edges through which you cut whatever you want to cut. And so the fulcrum is binding, connecting the handle and the teeth of the scissors, right? Now, that if you look at that fulcrum, it's like a blockade. It's like a blockade. You know, when you want to cut, you bring the blades together, right? And then you can also take it the other way, like you are contracting and you are relaxing, right? Now, because there is that up and down movement along that fulcrum, imagine your blood vessels like that. Imagine your blood vessel being like that. And so if you have the blood vessels or the blood cells, you know, the red blood cells looking like that, it means you cannot have, you can't have the blood cells, you can't have free movement of molecules. And you know, the blood or the red blood cell, especially, is the major means or medium of transport in the transport system of the body, circulatory system, that helps in moving important molecules, water, everything that you need. When you eat your food and your food gets digested, and then it turns into smaller molecules or absorbable forms like amino acids for proteins, or glucose for carbohydrates. You have fatty acids and glycerol for fats, right? These absorbable molecules are being transported all around your body via the bloodstream. And as such, if there is an inhibition, if there is any form of inhibition or anything that could hinder the free movement of molecules, these molecules includes this essential, of course, you know, amino acid is of course will be needed for productions you have in your system and nature. So you need water, you need the oxygen when you breathe in, and then the cells respire. How is the oxygen transported? As the oxygen enters your lungs must find a way to transport, to send that oxygen to your heart. The heart picks it up and the blood becomes oxygenated and is transported to the brain, the liver, and every part of the body, especially the brain. So if there is any problem with the circulation, you understand that there will be a problem. And so what happens to a sickle cell anemia patient is that the blood cells are sickled. So there is no free movement. There's no free movement of oxygen, of molecules, of essential molecules around the system. And as such, because there is an inhibition, like the blood vessels, the blood cells will be struggling. There's a struggle within to push these molecules to have free flow. It is that push, that force, all right, that is being experienced as pain. All right, that is why one of the major symptoms you see with patients or people who are sickle cell is that they have consistent number of episodes of pain, because there is a regular inflammatory response. There is a consistent inflammatory response, and that inflammatory response gives birth to pain. I will not go into the pharmacology of that, but the point is this: that anemia patient or sickle cell patient have a genetic disorder, a genetic problem. Now, what causes it? There are three major genotypes. You have the AA, you have the AS, and you have the SS. However, there are other variants of genotypes, not just the AA, AS, and SS. We have seen people who are also AC. We have AC, and we have SC, and in some races, all right, you may even have AG. I have seen a patient. By the grace of God, I am a geneticist, right? So I'm a genetic scientist. So we have counted patients who are not any of those ones I've mentioned. They have what we call AG. You get what I'm talking about. So, but majorly, what we have the AA, you have the AS, and you have the SF. Now, when somebody who is AA gets married to a person who is SS, there is no problem. An AA person going to marry an SS person, there is no problem, because the person is SS and this other person is AA. When they copulate, there's a crossing, and when there's a crossing, you have AS throughout. So all the offspring will be AS, 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 AS. Now, when I say offspring, so I'm giving all this background knowledge because that is the basis of this discussion. Once you can get it right here, you can even educate others. So it is important that this is discussed. Now, we do not know the number of eggs or babies that a woman is liable to produce. You don't know the potential of the number of children, the probability exactly of children, or the number of children or eggs that a fertile woman can produce all her life, especially during her reproductive age. So, for example, a woman may have the capacity to produce 100 babies. She can produce 100 babies, 100 eggs. Do you get what I'm talking about? Now, if that is the case, if a person who is AS gets entangled with another person who is also AS, we are going to have AA, AS, AS, and SS. It means you're going to have 25%, right? Or of 25% of the 100 will be AA. 50%, right, will be AS, because you have AS, you have AA, AS, and SS. You have that's the filial genetic, the first F1. You have AA, you have AS, and SS. So if that AA is 25%, because you have 4 people there, 1, 2, 3, 4. A quarter of 4 is 25%. So 25% of the potential number of children that woman can produce from that union between her and the man. Imagine that both of them are both AS. The both couples, the both parties are AS. They are going to have 25% of every child she's going to have will be AA. Now, 50% of the 100, we don't know what she can give birth to. We don't know the number. It could be 10, it could be 5, it could be 1. It could be 100, it could be 1 million. We have women who can produce 100 children. Some can be 200 eggs. And the woman can produce as many eggs as possible in her lifetime. And that is why you have menstruation. During your menstrual cycle, your menstruation period, you are burning out a lot of blood. The eggs are broken and they flush out. So A woman can have over 1,000 or 500 number of eggs over her lifetime. We do not know that. We don't know how many a woman can. Only God can predict that, right? But what we can do is to do our basic analysis. So if for every 100 children, for example, Mrs. Uwosu can produce, we are saying that out of that 100, 25%, which 25 of them must be AA. 50% will be AS. That means 75% of the cases will be okay because AA and AS, they are fine. There's no problem. Then you now have another 25% that must be SS. Now, we have a problem now. Like, I think if that's the case, why are we now worried? Why are we not bothered about SS? Because since it's only 25 that will be SS, 50 will be AS, 25 also will be AA. So 75 is higher than 25, right? Fantastic. Where the problem now lies is that we do not know the arrangements, the positioning, the probability. What we have just done now is that out of that 100, 25 will be AA, 50 will be AS, and 25 will be SS. Now, but the problem is we do not know how they will be arranged. So it may be that the first 25 will be the SS, and the next 50 or the next 25 will be AA. So you don't know how it will be arranged. So that's why you can see that a woman can have all 4 or 5 children, and all of them will be SS. So if she has a potential to produce, let's say 10 children in her lifetime, out of that 10 children, we are saying that 2.5, right? 25%, 2.5 will be what? SS. You don't know that 2.5, that means like 3. So you don't know where that 3 will come from. The 3 could be the last 3 children out of 10. That means the 7th, the 8th, the 9th, and the 10th child. It could also be the 1st, the 2nd, and the 3rd. It could be the 1st, the 5th, and the 6th. So it is a very serious risk that you should not gamble because you don't know the positioning. And more often than not, it is usually the first set of babies that will be SS. However, we do not know the arrangement. So that is why there is no reason why any young person should be involved in this. A lot of our old ones, our old parents had this problem, and they called them abiku. Some of them were killed. You give birth to a child, and the child dies. Some people die at the point of birth because of the sickle cell. Some of them may not even last during pregnancy, or you may have complications, and even during delivery, the child may die. You can have preterm labor, and even when the child is born, some people are not aware. And so the first 7 days, or even 1 week or 2 weeks, the child dies. And they say it's Ogbanje. It's not, it was actually sickle cell. No, they were sickle cell children. But why do you want to put a child in that kind of a mess? Because of your ill decision. So we have an opportunity to change the narratives. We have an opportunity to change these figures by educating the young people around us. Tell your children, educate them. If they need further clarifications or knowledge about this, they can seek counsel, they can call us or ask us questions. We are available to provide them the right information. I believe with these things that I've said, I believe it's clear enough. Whatever I will say next from this slide is just an add-on. I have given us the basis. And there is no, because it's a genetic problem, there is no medication to cure it. You can't cure it, it's not curable. It is not curable. There is no medication to cure it. So it's not as if you take your child, you also say, I don't know, come and let me prescribe and take this medication 2 times daily for 1 month. It is not curable. You live with it. And the problem associated with it is a lot of problem because the patient's cell is anemic, is sickled. You have a lot of issues, crises here and there. Why put a child through that risk? Why also put yourself through that kind of stress all through your life? Okay, just for this sake, let me just look at a few things. Let me talk about a few things from this. So, how do you diagnose a person that has sickle cell? It's simple. There is no other way. You when you see, of course, in some countries like the US and UK, where they have proper health structure, once the child is born, basically, all right, even right from the womb, they have done the basic things to know if the child is a sickle cell, so they can start making all the plan, right? Especially, of course, they're going to have the details of genotype of the parents. So from that, once they get the genotype of the parents, for example, if the parents are both AS, right, or one of the parents is AS and the other is if both parents are AS, right? Because if one is AA and the other is AS, there's no problem. It means you're going to have AAs and AS, so there's no problem with that, right? And so where the problem comes now is when one of the parents is SS, right, and the other is AS, or a situation where both are AS. That's where you can have. So by the time they get those data, all right, so even right from conception, the doctors or the healthcare providers are already, they could do for that test to know if the child is sickle cell based on the genotypes presented by the parents. Okay, so, but let's assume that the parents never knew, and then you walk into the hospital, say, my child has been having this, I've been having these complaints about my child, always having pain, he's always looking weak, and then you go to the hospital, they look at the child. All the things you look at, there are physical examinations they will do. You look at the eye, all right? Sometimes the eyes, this white eye, this white part of the eye, is it the pupil, call it now, or the cornea, right? Is usually yellowish. It is yellowish. Why is yellowish? It's as a result of certain proteins that have been released from the liver cells, right? And because the cells are thickened, so you don't have free movement of essential molecules that will be needed by the liver and some other vital organs. And so when the liver wants to respond to that problem, all right, most of the time you will see coloration of the eyes. You see, when you see that yellowish coloration around the eye region, it's majorly because of the liver, and that is suggestive for a sickle cell anemia. So when you see a child or a person who is sickle cell, right, sometimes you see their eye yellowish, right? And then you also look at the physical morphology, right? Morphological examinations of that person. You ask basic questions: how long? What have you been experiencing with this child? The mother complains of recurrent pain episodes. The child is always looking weak, fatigued, and all that. Okay, so if they have, and then once they do the genotype of the parents, or they ask them, not even asking them, you want to confirm to be sure. So they run genotype. That is why I think everybody here should know your genotype. In other parts of the world, I don't know if we have it now in our driver's license. You should have it on your license, your ID card, your genotype, and your blood group. Everybody on this platform, I think we can make it another subject for discussion. Blood group and genotype. I think it's something we need to discuss separately, so that you have a full understanding, right, of what blood group is all about. Because some of us, we don't even know those who can donate our blood to and those who can receive blood from. And so these are basic things that you don't need to be a scientist to know them. These are basic things that we should know. So even on your driver's license or your IDs, you should have all these things. In any case where there is an emergency, something could happen somewhere and they are not able to communicate, they're not able to contact your loved ones or something. Because of that card you have, every details about your blood group, somebody is distracting us, your blood group, your genotype is there. So they can quickly look at those things and know what to do in those countries. And I don't know if we have them now. So that is why everybody here, you should know your blood group. If they ask what's your blood group, you should say it at the top of your head. It's not something you think about. It's not something you look at your paper to know. Once they ask you your blood group, you should know it. Your genotype, you should know it. At the tip of your finger, you should know it as much as you know your name. It's very, very important. Very, very important. Very, very important. I knew my blood group right from my secondary school days. O+. Nobody needed to tell me. So if you ask me anytime, I know my blood group, I know my genotype. This is very important. You should be your children's blood group as young as they are. Be singing into them. Say, son, you are this. Daughter, you are this. Be singing. Let them be rehearsing it. Let them know it. Right. So at the end of the day, what the only thing that can be done basically to treat patients with sickle cell anemia is to manage the crisis. The crisis associated with them, because first the cell is sickled, and so there's no free flow, there's no free movement of molecules. So once the oxygen cannot have a free flow, a free movement, what do you observe? The most time you experience chest pain. The chest pain is synonymous to angina pectoris, because there is a force, there is an obstruction of movement of oxygen. Excuse me. So as the oxygen passes through the lungs and gets to the heart, all right, and the heart picks up the oxygen, to move it around is a problem because the cells are sickled. It's sickled. So there is a force you are pounding on the blood vessels and the blood cells. As a result, the only thing it will give you is pain. You will express it as pain. And so if the patient is having pain, more often than not, we place them on opioids. Originally, because if you place them on NSAID like diclofenac sodium, the patient may likely be ulcerative. I mean, they could be prone to ulcer. They could have ulcers. And if the patient has peptic ulcer disease or has ulcer of any kind, which is most likely going to be the problem, you don't want to give them NSAID, non-steroidal anti-inflammatory drugs. If you give them that, because those drugs also, they are acidic, so it will also elicit that acidic reaction, and then the person's mucosal lining and all that could become ulcerated and a very painful sensation. And so what the doctors will do to manage that pain properly without necessarily eliciting any kind of ulcer is to place them on opioids, right? And what are opioids? Example of opioid is tramadol. Tramadol is a very common opioid. And the flip side again is this. That is why I am begging and soliciting with us that we should educate our young ones. Educate our young ones. There is nothing like love. Don't bother about that. There's nothing like love. Because of love, you want to put a child in that kind of situation, right? And so the best they can do is to manage the pain. Now again, because there's an obstruction of the movement of oxygen, you have weakness. The person will be weak because energy is not passed. Glucose too cannot pass. Molecules cannot pass. So you have weakness, general weakness. The person will be having some kind of distorted growth because even some proteins cannot pass. Essential nutrients cannot pass. And so the person is looking generally weak. So one of the things you also want to do, how do we now boost the person's energy profile? So you look for energy, energy stimulating stimulants, right? Or molecules that you can give to that person. So that is basically that on that. Now, before I wrap it up here, how do you prevent sickle cell anemia? How do you prevent sickle cell anemia? So if I ask anybody here now, how do you prevent sickle cell anemia? It's very simple. How do you prevent it? It's very simple. Know your genotype. As simple as that. That's the way to prevent it. Know your genotype. Once you know your genotype, you know that you can take the right decisions. You can't subject an unborn child into a mess that they didn't want, they didn't bargain for. So simply know your genotype and avoid it. As simple as that. There is no better way to prevent it. Know your genotype and take the right decisions. Now, finally, before I wrap it up here, there are new methods that scientists are beginning to explore in curbing the menace of sickle cell anemia, right? Of course, when a person is sickle cell or is anemic, like I've said, there is an inhibition of essential molecules and nutrients. So you expect the person could have pain. The person could also have series of infections here and there, because the antibodies that are needed, or molecules that are needed to fight against these external matters or invading microorganisms that could cause problems, you don't have them as much. They can't find movement. And so the person may also come down with a lot of infections and other cases. So basically, what the doctors can do is to manage the symptoms, manage the diseases or the infections, but they cannot cure the anemia. That is given. Now, however, there are newer ways that scientists are trying to explore. And one of the ways is the stem cell transplant. Now, the stem cell transplant, you know that the red blood cells are produced from the spleen, right? The bone marrows. The bone marrows, that is the source of the red blood cells. And the bone marrows, you find them around the joints, in some part of the joints, major part of the joint. And so that is where you have the red blood cells being produced. So even the cells that are sickled, they are from the bone marrows. So the idea is this, is that, okay, since these red blood cells, they are not just mutating. It's not a mutation to become that kind of cell. The mutation there's already a genetic reintegration that has taken place right inside the bone marrows, where the cells are produced, the red blood cells are produced. Also, and you know that the genesis of every cell, the origin of every cell is from the stem. So the stem cells have the capacity to proliferate, to differentiate, yes, into different kinds of cells. So, for example, if a stem cell is produced from the bone marrows, it can differentiate and find itself around the eye region, around the liver. Okay, so if the hepatocytes in the liver are having a problem, you can have stem cells proliferating and differentiating into hepatocytes. And so the hepatocytes, the dead hepatocytes, can regain a new life, because you now have stem cells going there to produce cells that look like hepatocytes. I don't know if you get what I'm talking about. I hope that's clear enough. So it means that with the concept of the stem cell technology, you can actually have virtually every cell in every part of the body being reproduced. Now, not just being reproduced, but reproduced in their normal form. Now, so since the what's it called? Since the sickle cell, the red blood cells that are sickled are actually coming from the bone marrow, right? And the bone marrow is the source, right? So what we can do, can we go to the bone marrows and repair it from that region? And so what they are doing now is to use the stem cell technology, right, to correct it from that source. But it has not been very, very, very successful. However, it seems to be the only solution or probable solution to solving that problem. I don't know if I'm making any sense to anybody here, because there is nothing you can do about it. The problem has been created. There is nothing you can do about it. There's nothing you can do. The problem has been created. So how do you solve it? You go to the root, go to the source. Can we go to the source and correct the problem there?
You have just nailed it.
Basically, the stem cell technology. Can we go to the source and correct it there? That's the idea. So if we can correct it from the source, ultimately we can solve the problem in the long run. However, like I said, this is a genetic problem. So it's not something that you can solve in one day. So if I told you that you just go and take the Superlight LCC, and in 2 years your genotype with your sickle cell anemia will be gone, I'll be lying. But how do you manage it much more effectively? It's very simple. If they can correct or reduce the proliferation of the sickle cells from the source, and I begin to have stem cells that can differentiate into normal red blood cells, it means that the episodes and the baggages, right, that are associated with sickle cell anemia will be highly reduced. That's the point. It will be highly reduced, unlike a patient who is basically taking some of all these medications that I don't even know about, because you can't stop, you can't correct what has the problem has been created. That's why we are pleading. And
so, Pam, thank you. You just nailed it. And we want to give the few minutes for Dr. Chuks to really contribute, since the network will permit him to be with us tonight. Doc, Pam, are you there?
I'm there. Dr. Chuks should come in immediately. I'm done, sir.
It's okay. So, Dr. Chuks, are you there?
Yeah, good evening, Jonathan.
Thank you. You're welcome, sir. Thank God for
Yeah, good evening, Dr. Rose and pharmacist.
You're welcome, sir.
You hear me, Dr. Rose and pharmacist Kilaka. Thank you very much for your lecture. Hello, are they hearing me?
Yeah, we are with you. We can hear you.
Okay. So thank you very much for your lectures. I think before we talk of the role of super life, I want to just do some little contribution.
Yeah.
There is a medical term called hemoglobinopathies. Hemoglobinopathies comprises of sickle cell disorders or sickle cell diseases. Sickle cell diseases include sickle cell anemia, include thalassemia, and other hemoglobin S variants. Those are what constitute sickle cell, don't constitute hemoglobinopathies. Then the basic genetic implication is that there is an amino acid called glutamic acid that is supposed to be in the position 6 in the beta globulin chain of hemoglobin. That glutamic acid in sickle cell anemia, that glutamic acid is replaced by another amino acid called valine. So because of that replacement of that glutamic acid by another amino acid called valine, that is now causing the genetic abnormality where the hemoglobin is now presenting as a heterozygote, or how will I call it, a trait that is peculiar to sickle cell. So that's why you are not seeing the disease condition. So that is the origin, that replacement of glutamic acid by valine. So the cell will now carry that nature, the red blood cell. Then, secondly, for us as a super life, when people present with those conditions, we have to be sure of the diagnosis. So we tell them to go and do just what the pharmacist wrote on the screen there. I was seeing hemoglobin electrophoresis. I was also seeing genetic test. Yes, you send them for that diagnosis to be sure whether it's sickle cell anemia or whether it is thalassemia or other sickle cell variants. That is the purpose of the diagnosis. And the proper diagnosis is that hemoglobin electrophoresis and sickling test or genetic test. You use the one to diagnose sickle cell anemia. So when you are not sure it's sickle cell anemia, you now know that it is inherited disorder. So you now know what to face. And the Super Life product that we engage is Super Life Total Care 30, STT 30, and the Super Life Immune Care, SIC. Now, just as the other speakers have said, it's an inherited condition that has to do with the gene. So since there's already a disproportionate representation in the gene, that condition cannot be corrected in that gene because the gene is already coding for that sickling trait. So it will continue to code for that sickling trait. And there is no way to replace back that glutamic acid that has been substituted by valine. Of course, that's why it is a genetic abnormality. So what we now do is to involve our ST30, which is a plant stem cell product that will help us do some certain things that will help manage the patient so that the patient will be devoid of crisis. For example, now with what the speaker said, like Dr. Rolf said, the cells, the red blood cells are sickled in shape. They are like crescent moon. That's, if you look at moon, now if you're looking at moon, if you divide moon into two, that half is called crescent moon. So these cells, the red cells are of that shape. So because of that, they look very sticky and rigid. Ordinary red blood cell is supposed to be flexible. Supposed to be spherical and flexible, so you can easily maneuver through blood vessels. But this sickle cell, it will, take the shape of a sickle or crescent moon and become sticky, so to be attaching to the wall of blood vessels. It will not be able to pass through blood vessels, and it will stop blood from moving through. And when blood does not move through, of course, you know that vital substances will not pass through, like oxygen will not pass through, like nutrients will not pass through. So you see that other cells that need oxygen and need the circulation will be devoid of it. So most cells will not be hypoxic. Most cells will not be hypoxic, that is, they are short of oxygen, and they might die of hypoxia. So that is what we do when we give ST30. ST30 contains phytochemicals like resveratrol, contains phytochemicals like arginine. So this arginine, they help to dilate the blood vessels so that they increase the passage and circulation of the cells. Despite how crescent it is able to maneuver and try to move by the facilitative effort of that arginine and resveratrol, which are potent phytochemicals and antioxidants in STC30 that we give to them. Also that apart from the dilation, the Super Life product, we know they are anti-inflammatory. The ST30, it has blackcurrant, it has ribes nigrum, it has Vicinium metallus, that is the bilberry. So it also has the Actinida chinesis, that is the golden kiwi. So these ones, what they do, they are anti-inflammatory. So they help to prevent inflammation. And when they prevent inflammation, they help to prevent transmission of a pain signal. So they prevent the transmission of pain signal by the sensory cells to the thalamus. So in other words, they prevent that pain signal transmission so that the person those crashes of pain will be eliminated. That is what we do. So it will try to prevent the crisis of inflammation, try to prevent the crisis of the inflammation-induced pain sensation. So that product, Super Life product, helps to prevent that. So these are some of the working mechanisms. So what it also does is Super Life product also, because they are immune boosters, like the SIC, they have phenylethylamine, which is an immune booster that has polysaccharide, which is an immune booster. They help to boost the immune system response of the spleen. The spleen is a reticuloendothelial system. The spleen is a reticuloendothelial system where red blood cells are broken down when they have completed their shelf life or their half-life, which is about 120 days. Of course, you know, a crescent-shaped red blood cell, that is sickle cell anemia, the red blood cell does not live up to that 120 days. So they have what we call induced apoptosis. They die before their time. They are easily broken down by the spleen, even at the end of 10 to 20 days. So that continuous breakdown of the red blood cell will increase the number of bilirubin, because the red blood cell, the breakdown of red blood cell, the impact of red blood cell gives rise to bilirubin. So that's why I see people with sickle cell having hyperbilirubinemia, and they also have a high urobilinogen, because they are all breakdown products of red blood cell. So Super Life products, what they do, they boost the immune system of the reticuloendothelial cells to modulate their immune response, so that they will induce delayed action in the breakdown of red blood cells. In other words, their shelf life will be increased, and so in that way, the infection that the spleen is also prone to will be minimized, because the immune system has been modulated to resist possible infection. So that is another mechanism of Super Life product, that is when you are giving to sickle cell anemia patients. Then not only that, the Super Life immune care, of course, is filled with a lot of B vitamins. Nearly all the B vitamins are in the Super Life immune care. You know the function of the vitamins. The B vitamins are immune boosters. So when the immune system is boosted, the person is able to resist several,
Now for left.
To infections. That person is distracting of so you're able to resist susceptibility to infections. So immune care has things like chlorophyll. That's things like chlorophyll, and they know what chlorophyll helps to increase the production of blood from the bone marrow. So through electron chain transport system, the chlorophyll boosts the red blood cell content and the production of red blood cell. So the chlorophyll works, helps to facilitate the bone marrow production. Now we also know that Super Life product is a stem cell, as the pharmacist was trying to explain. It's a stem cell. We know that red blood cells are produced from the bone marrow, from the erythroblast stem cells in the bone marrow. That is where the red blood cells are produced from, and even the white blood cells and the blood platelets, they are all produced from the bone marrow. So the Super Life product, as a stem cell, what it does, stem cell therapy helps to increase the stem cell potential of the bone marrow in able to. But what the only help our product does is that it, apart from inducing stem cell action in producing adequate stem cell that can differentiate, what it does that they try to mimic a normal cell. They try to mimic a normal cell, because why? As I said before, what the pharmacist was trying to say, it is genetic. There is that replacement that has been done, that glutamic acid has been removed, the amino acid sequence has been distorted. So even if the bone marrow is producing cells, the cell will still be taking that shape. But with stem cell therapy, they try to mimic a normal cell. They try to mimic a cell that's not Christian cell. So they try to exhibit that nature. So we try to exhibit that nature. The person will be leading a normal life, even though the genetic problem is still there. You'll be leading a normal life. So that is why we say it's management of the condition. So that's what stem cell therapy does. So the immune care, as I said now, increases the blood content, boosts the immune system, and help to prevent the person from being prone to other disease conditions. So I know our time is fast spent. I don't always like to waste time. I think that is what we do. Don't forget our product. We give them the administration for sickle cell anemia. Is you place the person on 6 to 9 months therapy. 6 to 9 months therapy of ST30 and XIC. Then after those periods, the person can be taking it alternately, maybe taking it twice a week, because you cannot just tell. I was what the pharmacy was trying to say, that if you tell you go and take ST30 2 packs and the sickle cell will disappear. No, it will not disappear. But just the rest, I thought once you are taking ST30 and SIC, the person will not get crisis. And the person will not be anemic. When the person is not anemic, the person, the liver is not affected, the spleen is not affected, then the complications are prevented. The person will be living a normal life by reason of that super life supplementation. So that is the what we do. ST30 by sublingual administration, then SIC by oral injection. You ingest, not injection with injection, I mean ingest. Oral, you swallow it in liquid solution. So that is what we do for that. So I think we're able to get what I've just said in the treatment and management of sickle cell anemia, which is one of sickle cell diseases and one of hemoglobinopathies. So thank you very much.
Thank you, Doc. Thank you, Amachilaka and Dr. Ebwe. You people, God will continue to bless you guys for this sacrifice. I know some people, I want to let our participants to know, 3 of them has been very wonderful. It has been a voluntary thing. No dime is being paid to any of them. It's a way of contributing to humanity, which I know is only Almighty God will duly reward them. And I still believe that we who are being informed, not only to have enough confidence to begin to lead a normal life, this information is not for us to be afraid, because knowledge is power. So please, I want us to keep praying for them, and can we go to the chat room and just give them 7 fire emoji? At least let's start from there. Please, just give the 7 fire emoji, the 3 of them. Yeah, Dr. Chus, I want to let us know that he has even volunteered that he wants to come physically in our Lagos office. Please pay attention. Pay attention, and it's this month. Pay attention on the date. He is coming physically on our Lagos office on the 29th and on the 30th of April 2025. So please, has been the one that God have used in packaging our manual, which we call Doctor in Your Hands. He is the one that lead the team of other 4 consultants in coming up with that wonderful manual. If you don't have such manual, please try to come to the office and get a copy. So he is going to be physically, and I'm sure the farm and Dr. Ebwe, even though that they are whatever, we are going to have a full house. So these experts are going to be with us. You will see them, you touch them, you have a personal consultation. And I am sure it's going to be 100% free. Even if we did not appreciate them, there's no way God Almighty will not reward them for this wonderful love that I've demonstrated. And again, I said, that is a way Super Life Nigeria, that is our own social, corporate responsibility. We have to provide this information to each and every one of us, to each families. So that's why I want us, even the next week, please make this Zoom room, this information, 1,000 people can be receiving it. I know we have only 100 capacity in our Zoom. We have not even filled it up, but even if it goes beyond 100 or 1,000, we can expand the Zoom room. We can have these wonderful experts, and we are not going to let our family members to come and hear it from the horse's mouth. Huh? That's why in our product, it's always said, inspired by nature, realized by science. Inspired by nature, realized by science. And now we can see all the medical people that have spent years. I don't want to begin to mention each of them. These 3 people you are seeing, that we have had their voice. Please make 29th of April a date. Make 30th of April a date in our Lagos office. If you don't have the address, as from tomorrow now, we are going to begin to share the flyers. Yeah, he just called me that he feels that he has a window that he would like to come to Lagos by himself. By himself. Please. Is a very wonderful, it's quite unique. It's not common. So time is not there again, but even at that, we want our new person, our new participant, maybe today is their first time in our meeting. Please feel free. Our company will give you products according to the company's price. You can't come to any shop, you say you want to buy Super Life. Our product is not meant to be in any pharmacy, in any shelf. You are supposed to use your valid ID card, whether NIN or voter's card or driver's license or your database of international passports, and your valid ID card to connect to the company. Our company is domiciled in Malaysia, meaning that you are coming as a customer. You want to begin to use this product. Even if you feel that you don't have any sickness, nothing is, you are normal, you can come to connect as a customer to optimize your health, to optimize it. So that's where you are going to, you and I, we need to be. So that when we talk about prevention is better than cure, it is only when we have optimized our health. So all these STC 30, this immune care, we need to, is a food. A lot of things that we're supposed to get from the food we are eating on a daily basis, the nutrients, the vitals, they are not there. And many of them, the few of them are very in a minute quantity. So, but when you have access to this product, it's food and it's highly medicinal. So you don't wait until maybe you are sick. It's not meant for only those that are sick. Even you and I that feel that we are not sick yet. That is, we have not gone for a comprehensive health checkup. So by the time you are taking it, is optimizing your health. It's better to be in that position. That's the ultimate goal. So once you connect to the company, all the product that you will be buying will be at the company's discounted price. I repeat, all the product that you'll be buying will be at the company's discounted price. During pandemic, that is when people know the importance of these products. All these products you see here. When they use it in Malaysia, they volunteered and gave it to the Ministry of Health in Malaysia. And as many that were down with COVID, none of them died that used this product. That was when it became a global product. And the company has still maintained integrity. Since then, they have never reduced the quality, the efficacy, the quality of the product. Rather, the company kept optimizing, upgrading the product. All the product has been upgraded. It was not the quality that came at the initial, which have even performed a lot of wonders, they have still added more active ingredients, meaning super active. So if you see anybody say want to sell the product to you, please suspect the person. The person is trading with fake. And fake products have their home domiciled in Nigeria. Even they went further to the point, not just only on social media, but even going to the big pharmacies and begin to showcase it there. And we know how dangerous. Many people that have bought that fake product, the ugly experiences they have witnessed. That's the few of them that survived, because it has the capacity to complicate your health issue, and many have even gone. When you are taking a product that is not genuine, sublingual, it doesn't waste time. So even if it is free, please query it. Somebody is dashing you. Query the source. We are yet to have any MOU with any pharmacy. I'm still as at date. And if there is any pharmacy that we are going to have any MOU, we will announce it. We will advertise them in our platforms. And that we will now know and monitor them. So our brothers and sisters that went to China and India and imported this thing, they spread it in all the pharmacy, have an MOU with them. I've visited so many of them. But you could see, you and I, you can just walk into the place you used to buy your drugs and you see it there. Innocently, you will just assume that it's genuine. Please, it's not genuine. That was why we had a very big event, 7th September 2024 at Radisson Blu. It was a very powerful event, purposely to create that awareness and a disclaimer. So please, those of us that can go to, we invited a lot of media houses, but the one I noticed that Punch newspaper do a very wonderful job. Not only having it in a hard copy of their newspaper on the 13th of September. That was when they printed it on their daily newspaper. If you can search for it, or you can go to their online, Punch newspaper online, just type celebration of plant-based stem cell technology. You are going to see Super Life pump up and you will see our disclaimers over there. We want to thank God and appreciate NAFDAC Nigeria, because having certified our product last year has now distinguished us. So we don't have any rival, said to say. So, and that's why I said that since God came and said, let there be light, darkness ceases to dominate. So since last year that NAFDAC Nigeria certified all our products, that to me is that let there be light. So those that are selling fake products or what have you, I think that case has been closed. It's closed. So our job now is to let our brothers and sisters to be aware. So that's why some of this, whether online or physical meetings that we normally have, we cannot miss not to place this disclaimer. So please carry it. Don't say because they say cheaper, then you buy something for your brother or for your husband or for your wife, something that will complicate the person's health and end up the person dying before his or her time. Say God forbid. So I won't go further than this. I want to check if there is any question in the chat room. Please, if there is any question in the chat room, please quickly drop it in the chat room so that the medical experts on ground can respond to it. We are going to read it out. So please quickly do that. We have few packages here. Let me, while we are giving you some minutes to drop your message, let me just talk about the entry packages. That is the only way you can access it. We have the one that we call Star Package. That one is 90,200. They will just give you this STC 30, 2 parts. It covers your money. And the company is going to give you a robust back office that will help you subsequent purchase. You will just sit down with your Android phone and place the order. As you place the order, generate your voucher, just forward the voucher to me. I'm the representative of the company in Nigeria, Lagos here. once I receive your voucher via WhatsApp, it will be verified and claimed, and your product will be delivered to you. If you are within Lagos, we have riders that will deliver to you. If you are in other states in Nigeria, we have an MOU with GIG Logistics. That's God is Good Logistic Courier Service. It can deliver to anywhere in Nigeria. If it is outside Nigeria, we use DHL. It delivers to anywhere in the world, globally. So the second package, we call it Promo Super, is on promo. So that one is 451,000, and you will receive 10 packets of this STC30 you are seeing, 451,000. Then you get the 10 packs, which could serve for your either 3-month therapy. Of course, you see, all of them is therapy. Whether 3 months, 9 months, or 12 months, whatever is the case, that manual carries everything. So the main super is 902,000. Then once you have that main super, remember it's only this STC30. If you are going to mix other products, which occasion always demand, depending on your peculiarity of your health issue, what you are handling, we know that STC30 is always number one, and with any other 1 or 2 of our products, depending on the health condition. So you can mix it. If you are doing super, instead of giving you 20 of STC30, you can collect 10, then the other one you spread it with the remaining, depending on the prescription and the recommended dosage. So please feel free. Nobody is going to add any money. That's why the moment you register, you are going to have access to Malaysia, so that if there is anything that you are confused, you can ask them a question through the email that you are going to receive. It's a way of checkmating leaders in different countries. So please feel free. Nobody will going to take advantage of your health. Rather, we are eager waiting for your testimony to be among the testimonials that we have had for over close to 8 years now that Super Life has been in existence. Like I mentioned about the management over there in Malaysia, they stand for integrity. In a normal way, when a company's product has been accepted, it has always been their model they will start removing the active ingredients. It will no longer be in the rightful milligram. They will start reducing it. But in the case of Super Life, you see them adding more based on the prevailing situations. We're having 9G and 12Gs and what have you. It's making so they are following the trend in order to ensure that we are having testimony upon testimonies. So I don't know if Coach Samson is there. Please, can you help us check the chat room? Can you help us check the chat room? Hello, Samson. Coach Samson.
I'm here.
Please help us check the chat room so that if there are questions.
Actually, there is no. What the only thing is this person, does Super Life has a product for a patient with asthma? Yes, we do.
I guess
For asthma, you can use SC30 and SRC for asthma. That is it. Then, please, sir, can you throw more light on how Super Life products for sickle cell and for how long does it take him? I think that person should check if that person is on Zoom. You can see it now. We place it there.
On the screen.
It's on the screen there. The numbers of the days
The dosage daily.
The dosage and everything is there. Please check.
16 weeks. For STC30 alone, use once daily for 24 weeks. Is displayed right there And that our manual carried a very, that's why I said Dr. Chus and his team, they did a powerful work that even SuperLife globally have accepted.
He says CT and, sir, he says CT and SIC.
STC and
SIC.
he said
Twice
twice
morning
for
and
16
night.
nights.
Then for SIC alone, use ons daily. That is after that time. That is the review. After that time, you can now use ST30 daily alone.
For another 4 weeks.
Yeah, yes.
So check any other question. Please, if
hello, listen, Jola King. What we're seeing there is very clear now.
It's very clear, yes.
If you are using ST30 and SIC, it's 16 weeks.
Yes.
Okay.
If you are using only ST30, it's 24 weeks. It's there now. Why are we changing it?
Yeah, that is exactly what we said.
You don't use one first, later you not continue with the other one.
No.
If you are combining the two,
if you are combining
it,
16 weeks, yes. That's good. Morning and night.
If you are using only ST30, morning and night, 24 weeks. That's what he's saying.
It's okay.
So using
for the asthma, you must not rule out the medical intervention, which the person is giving, whatever the orthodox medicine the person is giving. Don't deprive the person from taking it, because some period of crisis challenge the person will be restored by quick intervention of a medical intervention. Then the SROC will be taken twice. Because we didn't tell the person for the dose of the asthma twice daily. The ST30 is also twice daily. You place the person on 3 months treatment to start with. Of course, the treatment, asthma is also most times inherited condition. So the person will not just stop. When he gets relief, he will now be taken alternately, the SROC and the SuperLife Total Care ST30. So that is it.
Thank you. Please don't remember the dates. The Dr. Chus will be with us. Let me repeat it again in case if you are just joining us. On the 29th April this month and on the 30th at our Ikeja office. So I don't know, Samson, can you just display the Ikeja office? Because I know there are new people who are not yet in our platform, in our WhatsApp groups. Please display, type it on the chat room. Some of them can pick it.
So, sir, when we out with the flyer, we will share it.
The flyer will,
when the flyer is out, we will share it for them to see the full address. But it's still Gaffer close.
So